Do orthodontists still need to extract teeth? I have found there is no more confusing area in orthodontics than the existing perceptions, real or imagined, of extraction versus non-extraction orthodontic treatment. Why do some orthodontists recommend extractions while others do not? Are there orthodontists that are recommending extractions using outdated methods? Or are the orthodontists recommending arch development or non-extraction treatments, just trying to tell the patients and parents what they want to hear? In this short video, I will attempt to provide additional insight so that the listener will be better educated and able to make a more informed decision regarding orthodontic treatment. My name is Jeffrey Miller. I am a board-certified orthodontist with over 34 years of clinical experience. I have spoken both nationally and internationally on the use of cone beam CT 3D imaging as it relates to orthodontic diagnosis and treatment planning. Unfortunately, competitive pressures between orthodontic providers has biased some treatment recommendations in the direction of telling patients and parents what they would like to hear versus what is actually the best treatment approach for that particular patient. Every new orthodontic provider with more than 15 minutes of experience quickly realizes that parents and patients prefer non-extraction treatment. As an orthodontic specialist, claiming that you prefer to treat your patients without removing teeth is like saying you prefer peace over war. It is a universal truth that orthodontists, and I mean every orthodontist, is going to avoid pulling teeth if there is an equal or better alternative. Unfortunately, the counter-argument is not necessarily true. For example, there are orthodontists who will attempt to treat every case without pulling teeth. This treatment philosophy is inconsistent with most accepted orthodontic theories and, in my opinion, not in the patient's best interest. This is Crystal. She's an adult female patient. She has both upper and lower dental crowding. There are several treatment strategies to correct the alignment of her teeth. I would like to compare two by virtually simulating those treatments. These are Crystal's virtual models. As you can see, she has dental crowding in both the lower and the upper arches. Here is the finished virtual result. This shows the teeth being straight. Here's the upper arch. You can see the teeth are all very well aligned, and this looks fine. There's more to orthodontics than just aligning the clinical crowns of the teeth. In other words, there's a root and there's bone that play a major factor in the alignment of the teeth. There's a science to this. That is why orthodontists spend 2 to 3 years after they've completed their dental education. If your world or your universe is just aligning the clinical crowns, orthodontics just becomes a mechanical alignment of teeth, or even worse, the mechanical alignment of the clinical crowns. As you can see, here's the virtual simulated result. It looks fine. If we start to use a more sophisticated tool to simulate treatment using a cone beam CT, here's what you end up with. So these both are exactly the same simulations. The difference is I've turned on the bone imaging and the roots and removed the gingiva or the gum tissue. And take a look at how these roots are pushed through the limits of that bony housing. Here's what she started with. You can see this is a much more desirable tooth-root relationship, although the teeth are not aligned here. If you align this patient by just expanding or developing the arch, you're probably going to end up with something close to this. Now, I'm not suggesting to anyone that because I'm simulating this treatment on a computer, this is exactly what is going to happen. It's more complex than that, but this gives you a general idea probably of what not to do. Here it is from the side. You can see how the roots, once you're able to visualize the bone and the roots, you can see how these roots have just been pushed through the limit of the bony housing. And here we go again. This is the original. Also simulated treatment with the extraction of 4 bicuspids. Not sure that's actually the best treatment approach here, other than it makes a point that by extracting 4 teeth, these teeth are much better situated in the relationship with the bony housing that supports them. And you could see the comparison Up here on the top is where we extracted 4 bicuspids and simulated treatment. And here on the bottom is when we used arch development or expansion. Arch development and expansion, by the way, are used interchangeably. Okay, so let's look at an actual case and see what happened here. This is a case that an orthodontist shared with me. He felt that he wanted to treat this case a non-extraction with an arch development treatment approach. And here's what he ended up with. As you can see in the final photo, this looks beautiful. The teeth are well aligned, but these are just the clinical crowns of the teeth. And just like those other examples, they didn't show you the whole picture. Now, if you notice, this patient's already starting to get some tissue dehiscence or tissue recession in this area of the lower left central incisor. But just like the virtual model that didn't show the bone and the roots of the teeth look well aligned, but that doesn't mean that's good treatment. When you take a look at the cone beam CT on this patient, it tells you a completely different story. Now, this cone beam CT was taken 3 years after this patient completed orthodontic treatment, and you can see that this patient just has generalized roots pushed past the limitation of the bony housing with the hist. I sent this patient's cone beam CT to a board certified oral maxillofacial radiologist to be read, and one of the things he came up with, he says that 14 teeth, as you can see here, have possible loss of buccal bone noted at the cervical and middle thirds of the root. Okay, so that means 14 of 28 total erupted teeth have lost 2/3 of their buccal bone potentially. Certainly in anyone's universe, that's not a good thing. Now, I do also need to mention that whenever you get these reports back and they talk about, the loss of bone, they're always going to say possible loss of bone. There is an ongoing debate regarding the accuracy which cone beam CT can pick up and display very thin bone. I do not believe that it's that relevant to this particular case because of the magnitude of the violation. In other words, the teeth were pushed so far out of the bone housing. That argument really doesn't make that much difference in my opinion. Thanks for listening. If you have any questions, you can email me at drmiller@orthodonticasos.com. Thank you.